Platelet-rich plasma, or PRP. What you need to know about it. What is PRP? How does it work? Hey folks, be sure to subscribe to this channel if you're watching YouTube and share this video on social media. Your loved ones are going to appreciate you for it. I'm Dr. Jeff Williams, and I want to talk to you about one of the newer and more exciting ways of treating joint pain these days. Platelet-rich plasma, or PRP, is a regenerative medical treatment that uses the body's own healing factors to promote healing and tissue repair. PRP is made by drawing a small sample of blood from the patient, spinning it down in a very special centrifuge that we've purchased in order to separate the platelets from the other blood cells, and then injecting the platelet-rich plasma back into the patient's area of complaint. Platelets are a type of blood cell that plays a very vital role in healing. They contain growth factors and other proteins that can help to stimulate new tissue growth. PRP injections are thought to work by delivering a high concentration of growth factor-rich platelets to the injured area, which can help to accelerate and improve the healing process. PRP injections are used to treat a variety of conditions, including sports injuries, joint pain and arthritis, tendonitis and bursitis, hair loss even, and skin rejuvenation. The most common joint injections, let's talk about that. The most widely used and commonly known treatment for joint pain right now is probably corticosteroid injections. And while they're good for rapid pain relief and anti-inflammation, they're well known to be short-lived, providing relief for only a few months, and that's assuming that they work at all. Many times corticosteroids, they don't provide any relief at all. The main problem with corticosteroid injections is that the provider will usually only perform a short series of injections due to the risk of damage to the joint structures in the region of the injections. That damage can include infection at the injection site, tendon weakening or even rupture, probably rare, but still, cartilage damage, bone death or bone thinning, thinning of the skin and soft tissues around the injection site, whitening or lightening of the skin around the injection site, fluid retention, high blood pressure, and elevated blood sugar levels. PRP, on the other hand, comes from the patient, so the risk of adverse effects is greatly reduced, rendering it mostly safe with few to zero adverse effects at all. So what's the word on PRP? Well, the evidence on the effectiveness of PRP therapy varies depending on the condition being treated. For example, there's strong evidence that PRP injections can be effective in treating sports injuries, such as muscle strains and ligament tears. So here's a summary of the evidence of the effectiveness of PRP therapy for some of the most common conditions it's used to treat. Sports injuries. PRP injections have been shown to be effective in reducing pain and improving function in patients with sports injuries like muscle strains, ligament tears, and tendonitis. For example, a study published in the journal Orthopedics and Sports Physical Therapy showed that PRP injections were more effective than placebo injections in reducing pain and improving function in patients with chronic Achilles tendonitis. Joint pain and arthritis. PRP injections have been shown to be effective in reducing pain and improving function in patients with joint pain and arthritis, including knee osteoarthritis and shoulder arthritis. Hair loss. PRP injections have been shown to be effective in promoting hair growth in patients with androgenetic alopecia or male pattern baldness. However, the results of studies on the effectiveness of PRP injections for hair loss, they've been mixed a little bit. Now, skin rejuvenation, PRP injections, they've been shown to be effective in improving the appearance of aging skin. For example, a study published in the journal Dermatology and Therapy found that PRP was effective in reducing wrinkles and improving skin texture in patients with aging skin. How exciting is that? LA orthopedic specialist has this to say, quote, "Cortisone shots usually kick in within 1 week. The pain relief can last a couple of months or longer. Regarding PRP therapy, it does help speed healing by flooding the injured area with additional resources, but it still takes time for the natural processes to play out. Most people start to see an improvement with PRP within about 6 to 8 weeks. Unlike a cortisone shot, though, the effects of PRP shouldn't wear off because this treatment helps heal the injury. Because PRP therapy comes with fewer risks, This helps boost healing and can provide more permanent pain relief. They say we often recommend it over cortisone shots for overuse injuries. A recent research project proved, quote, PRP treatment shows significantly superior and sustained pain-relieving and functional improvements compared with corticosteroid intratendinous injections. Another study showed that, quote, corticosteroid injections provide rapid therapeutic effect in the short term, with recurrence of symptoms afterwards, meaning it comes back, compared to the relatively slower but longer-term effect of PRP. Now remember, corticosteroids can be detrimental to the joint structures. For us, PRP is the superior option with regard to risk management. Another study proved, quote, PRP demonstrated a statistically significant improvement over corticosteroids in a 1-year follow-up. So is PRP right for you? Well, PRP is not right for everyone. It's important to talk to your provider to see if PRP therapy is a good option first. Your provider will consider your medical history, the condition you're trying to treat, and the potential risks and benefits of PRP before making any recommendations. So PRP therapy is a promising new treatment that has the potential to treat a variety of conditions safely and effectively. And if you're considering PRP therapy, it's important to talk to your provider to see if it's the right option for you. If you're in Amarillo, Texas, or the Texas Panhandle region, and you're looking to get started with PRP, why don't you give us a call at 806-355-3000. Let us help you get better faster. If you're watching on YouTube or social media, do your people a favor. Share this information just as soon as possible. Some of them, they're looking at surgery, and there may be better, safer answers like PRP. Until next time, thank you for watching, and we'll see you then.